Hi, I'm Serena. I'm a fourth-year medical student at Hong Kong U, and I'm joined with Dr. Teck Chuan, who is the head of the Office of Ethics in Healthcare in Sing Health.
Hello.
Welcome. So can you tell us a bit more about what you usually do in your day-to-day work?
Yeah, so I used to be an academic based at the National University of Singapore Centre for Biomedical Ethics. And recently I moved to Sing Health, which is a cluster of public healthcare services in Singapore. So on a day-to-day basis, I work with healthcare professionals to identify gaps in the system that could create ethical issues, and then trying to create policies, guidelines, other kinds of support services to prevent or address those issues.
Right. That seems like quite a big jump from academic work. Do you think so?
Yeah, it is. The official nature of my job is administrative, but I do also have an academic appointment with the Sing Health Duke NUS Medical Humanities Institute. So that's where I do, we focus a lot on delivering training in ethics, both clinical and research, to healthcare professionals.
Right. What is your biggest motivation of jumping from academic to more, practical administrative work?
Well, that's a good question. I was reflecting on this, and it seems to me that even as an academic, my trajectory was moving from more theoretical, philosophical stuff. So I'm trained in philosophy and medical jurisprudence. But towards the last few years of my career as an academic, I was focusing a lot on policy work. So I was doing a lot of policy work for Ministry of Health, serving in a lot of ethics committees, doing some work for the WHO in terms of policy. I led the work on immunity certificates for COVID-19, for example, for WHO. So I was really moving towards the kind of work. So I think this is a better fit for where I think I want to, for what I want to do for the rest of my career.
Right. I think you mentioned that one of your interests is research ethics. Is that right? So how much of your work right now in administration and policy changes is related to research ethics?
Yeah, so in my day job as the head of the Office of Ethics in Healthcare, I do focus a lot more on healthcare issues, less on research ethics. There is an office for that, an Office of Research. That's the Institutional Review Board, which is the Research Ethics Committee in our system. And then there's also an Office of Research Integrity, Compliance and Ethics. So we do work closely together. What I do, I think, at this moment in time is to kind of focus on trying to identify gaps also. And in about 2 weeks' time, in March 2025, we are organizing a workshop to advance ethical practices, looking at the areas where research and innovation might blur, and then create, and hopefully to sort of identify practices that could provide adequate ethics oversight, even for practice, activities, innovative activities that are not considered research.
Right. So I think in your previous job you did education for medical students on research ethics, and as far as I know, you're also doing some education for healthcare professionals on research ethics right now. So what do you think is the main difference, the target audience being medical students or healthcare professionals?
Yeah, so I did teach a whole module on research ethics back when I was academic at NUS. The students were primarily PhD students, whether from a medical school here or elsewhere. And the whole idea is really to get them to be able to understand basic ethical principles, things like respect for autonomy, beneficent justice, but apply them in the research context.
Right.
So there was a lot of focus on trying to build up their competency, for example, in ethics analysis in the context of research. For healthcare professionals, it's a lot more on getting them to understand not just this, but also what they need to do in order to conduct research ethically. So there's a lot of focus on good practices, very practical application of the issues. Of all these concepts, and also trying to get them to think about new practices that can make things more efficient, but at the same time protecting the rights of participants, for example. So think about new ways to do consent and things like that.
Right. And how is the reception usually like in these classes?
As usual, nobody wants to hear lectures nowadays, so you have to focus a lot on case discussion. That's where the energy comes,
Yeah.
And when you do that, I think that people really get to it, and you see the conflicting opinions sometimes on particular issues, whether it's human subject research or animal research. People have different moral viewpoints, and you can see the sometimes the biases coming out.
Right.
And it's good to address them and think about where your horizon is in terms of your moral thinking. So it gets exciting at sometimes. I think for the adult education, the professional education, is really about trying to meet the frameworks either set by law or your institutions, but also at the same time to be addressed questions of an ethical nature when you do arise in the course of research, even after your research has been approved by the IRB.
Right. So do you think the opinions or value contradictions would be more intense once your target audience is perhaps more experienced in research themselves? Or do you think they're actually, more aligned in thoughts than, let's say, PhD students?
It depends on how you structure the teaching. So sometimes when I teach people who are not in practice yet, there are certain things that I, just playing devil's advocate and getting people to play sides, right? And sometimes I'll put that in debates so as to structure the entire dialogue and really open up the mind about what ethics is really about, whether it's research or clinical practice. When it comes to professionals who are really busy and taking out the time to attend your course, you really don't want to do that. You want to sort of provide them the frameworks, the support, for example, to be able to do their work effectively and in compliance with whether international guidelines or your institutional policies. So that's the focus of the thing. But at the same time, we're also trying to sort of think through what is it that we can do to improve our practices.
You bring a very good point on bringing case studies into, more theoretical concepts in research ethics, because that's also kind of what we are trying to do with our project. Unit 731 is kind of our example that we're trying to bring out. What do you think? Do you like using cases? Because obviously there are pros and cons. The pros is it really sends a message out very vividly. This happened because of that, and it kind of serves as a very heavy moral reminder. But at the same time, when I was talking with my friends, they're like, these are horrific examples sometimes, and I don't want to be associated with those, demons that carried out those deeds. Like, I'm not one of them. So why are you trying to make me feel guilty about these people? They're unrelated to me. Do you think that would perhaps be a concern? How do you address that in your class?
Yeah, so, research ethics is riddled with a lot of scandals even to these days, whether in a local, particular context of a jurisdiction or on international basis in terms of international research conducted by multiple countries. And it's good to maybe get people to understand that this has really happened, which is why there's all these process, which you may think is very burdensome when you actually do try to apply for your research to be approved by an IRB. But you can't just be stuck there. So when you use cases, it's also good to look at cases that exemplify good practices as a way to get people to think, okay, are these practices that I can adopt for myself? Things like community engagement, sending out, getting patients, if you're conducting clinical research, for example, involved to help with the design of your own research. So it's not just about getting stuck in controversies, which I think some people tend to do that, and putting people in a stage of uncertainty. But it's really to create certainty in what is the right thing to do, and what are the not so right thing to do, and what's the thing you must not do in order to comply with law.
That's a very good point, using both negative reinforcement and positive examples to kind of bring in the
it's
message.
a little bit like clinical ethics teaching. You can't just focus on all the bad examples because this is just a minority of people. I don't know, like maybe 1% of 90% of actions in a given year, only 1% actually constitutes unprofessional behavior, right? So you can't just focus on the 1% and focus on the 99% of behaviors which are actually good.
Right, that's true. The bad examples usually really drills into your mind. It's very remarkable, but sometimes we forget about the good things that happen in research ethics that we should learn about as well.
Yeah, the thing in terms of mitigating risk, not just for the institution, but for yourself, right? When you do research or you're treating patients, And so the whole idea of IRB is to help you to sort of mitigate those risks, right? Whether it's ethical risk or social risk or economic risk, financial risk, because you're, wasting people's resources and you're doing research that's not going to lead you anywhere. Any sort of evidence generation for to test some hypotheses, you're not going to do anything new, right? So it's about putting yourself in sort of doing the right thing for the right reasons and try to ensure that your own reputation and the reputation of the institution that you're working for are both protected.
Right. Since you mentioned IRB, I think me and Zohar recently did an episode on IRBs, and both of us were researchers and also we studied ethics. So I feel like it's a good thing to have, but sometimes it can get very, very bureaucratic. Do you ever feel like, being in the administration of research ethics, do you feel like sometimes the ethical principles are there, but when it gets put into practice, it could sometimes be less ideal in what we learned in theory and became more of, sometimes a lot of researchers think of it as, just a procedure I have to get through and don't really understand the message behind. Do you feel like that sometimes?
Yeah, if you ever think of a research ethics system. So personally, I'm not in the research ethics office, so I'm in a different office. And I don't really set rules or policies on research. But I do hear and the voices of people who feel that this is a very burdensome process, just hurdle to overcome in order to get to do my research. I think it's better to think of research ethics as a kind of ecosystem where there are all these kind of various things that you need to do in order to do things appropriately, whether it's the use of resources, using patients' time, for example, your own time, for example, right? And of course, at the end of the day, there has to be, I think, some sort of approving authority that says, oh, everything's in order, you can proceed. But there can be multiple forms of support, I think, along the way that can help you sort of identify the problems. Things can be a lot more efficient if, for example, there are protocols that are already there that you can look at that are similar to your own kind of research that you're doing, and so you can sort of follow. And then, of course, there had to be ethics training for researchers to get you to understand why this is important and what you're actually doing, the meaningful kind of thing that you're doing when you're actually engaged in this kind of process. So it has to be an entire ecosystem that you look at, not just that particular, what some people call the triangle relationship between the researcher, the IRB, and your patient or the participants. You have to move beyond that triangle to look at other things that could support you to do the right thing.
Such as the community involvement?
In some places there are research ethics consultation services, like Johns Hopkins, for example, as I understand it. So what they do is, if you need some advice, you can always call on them. And it's not just before you apply for an IRB waiver or approval. It's also after when you're conducting your research. And in the course of the research, even though you're following your protocol, you're also facing some sort of ethical issues. You might also be facing some sort of moral distress, like how you are as a clinician. And you can call on these people to help you think things through. So it's about having friends, partners that can help you think things through. So I serve as an ethics advisory board member for a multinational international project on tuberculosis treatment to develop new novel regimes that are more effective and shorter.
Right.
So from time to time, I'll be called upon to ask about my input on particular things that's happening, what are the kind of issues that are arising during the course of the research, are the privacy protections strong enough. So there's all sorts of things you can rely on, to make sure that you're on the right track in terms of doing research that's responsible, that can actually benefit society.
Right. Since your work is involved both in the regional, as in like Singaporean region, but also you are involved in the more global aspect of things, because I know you work with the WHO sometimes. Do you think there is any difference in perspective between ethics, or more specifically research ethics, between, let's say, Singapore or globally?
So I think the principles are, at the end of the day, quite universal.
Right.
Respect for people, respect for communities, social justice, making sure you're not exploiting people, taking advantage of the vulnerability to sort of enroll them in research because it's the convenient thing to do, they're an easy target. So these are all generalizable to any sort of setting. I think where the differences may lie maybe in how you put into practice those principles. So just to give you an example, how much do you pay participants for a given project?
Yeah, that's true.
Right? Somebody will say, well, maybe you should give vouchers, $500 may be too much for this particular thing. And so you have to sort of make a judgment at the end of the day. So I think where the judgment comes from may be influenced by your own beliefs, by culture, by the other kind of benchmarks that's already out there in your own society that you can use in order to set the right kind of standards. But at the end of the day, you think about what is it that you're doing. You're trying to protect research participation as an altruistic kind of endeavor, right? You're trying to sort of not get the right kind of wrong kind of motivation in the participants, such that when all they want to do is to enroll in your research, so that they can get an incentive, which may have particular effects on the veracity of the information to provide you, and that might screw up your entire data.
Right.
So that's what you're trying to do, right? The principles are there, but the practices may differ from culture to culture, society to society.
That's true. I think it's particularly hard if the research involves different countries. So researchers may be based in let's say like a more developed country, but research participants are recruited from a less developed country. So how do you, the issue about compensation that you mentioned, or even just the whole communication promotion of the research could be very different. It's a very delicate issue to deal with. Right. So what do you envision to be happening in your work life later on? Like, are there any new directions you want to focus on?
For research ethics?
For research ethics.
Well, I've been tasked to look at the ethics of AI research and how to create an appropriate process for testing and evaluating AI in our healthcare system. We do have an existing governance system, but there might be particular ways to improve so that the adoption or integration of the AI in the healthcare system, it doesn't introduce bad effects like introducing a lot of variability or variation in clinical practices in level of evidence, because that's something we want to avoid. We want to make sure that when it does affect clinical workflows, it doesn't really sort of, any sort of benefits of using AI outweighs the burdens and the risk of introducing it, including in terms of environmental sustainability. So if you're introducing a lot of AI in your work, it does consume a lot of carbon. The carbon footprint and the water footprint is quite large. So you want to make sure that you are putting the right priority in terms of what kind of AI that will be most valuable to your particular healthcare system. So that's something I'm looking at. Right.
So on that aspect, I've always wondered how AI being applied in clinical research and in clinical practice might be different. So the ethical issues that may be involved in research or clinical practice may be quite different. So are you going to focus more on AI in research or AI in actual clinical setting?
I'm focusing on determining, for example, when an AI solution, for example, when it's introduced to patient care, whether or not it ought to go to research or be regarded as research, and therefore ought to be reviewed by, go under the oversight of a research ethics committee, or when it's some sort of quality improvement project or a pure innovation project and does not need to because of the nature of it, the kind of risk introduced, for example.
Right.
So that's what I'm trying to look at. What is the best, what is in the whole entire ecosystem, how do we direct people who want to introduce some sort of AI solution to the right pathways that can ensure that the eventual solution is actually evidence-based. It does improve things overall, whether it's the use of resources or patient safety or efficiency and so forth.
Right.
So that's what I'm trying to do.
Right. So in a very, very gross categorization, do you see yourself more as a cautious person or a risk taker in this? Because there's always these two parties, we can always go take a step back and think about the ethical implication of this. Or are you more of, this is a new advancement, go ahead? What do you usually see yourself as?
That's a great question. I think you can put yourself in either category. I can put myself in either category. But at the end of the day, the introduction of any sort of process or guidelines in a given institution has to be met by layers of approval, and different people have different risk appetite. Right, so it's always some sort of multidisciplinary, different level of channel, different sort of risk assessment that you're going through. And so at the end of the day, the correct question I think is, what is the risk appetite of your institution where you're introducing certain things, not your own personal
That's
risk
true.
appetite. Yeah.
Right. So what do you think is the risk appetite of the current institutions that you're working with?
No comments on this. But we do put, I think, I can't speak on behalf of the institution I'm working for, but I think at the end of the day, for any sort of healthcare institution or system, the priority has to be on patient safety and respect for patients.
Right. I guess the ultimate question is, do you think when it comes to AI, are you an optimist or a pessimist?
Well, I think it does help in many things. I use AI on a regular basis. Just a few days ago, I was using it to generate some cases for the workshop on research ethics that I'm going to conduct. It looks pretty good. I've got some people to vet it because it's on genomics, and I'm not a genomics researcher, and they said, yeah, it looks fine. Yeah, so you can use AI, but you have to understand when or the impact on the development of the user. So I think the biggest risk of AI is eroding judgment.
That's
So
true.
if you're regularly using certain things, for example, let's say you're always using your calculator to calculate sums, you're using your phone to memorize, which will record all the phone numbers, so you don't have to memorize things anymore, the phone numbers of your friends. Certain competency and ability do get affected. So for whether it's your medical student training or your judgment or morality, what do I do instead of just type in a case scenario, you get an AI to sort of determine what to do. Your own judgment, I think, at the day may be affected and perhaps eroded.
That's true. I've always found AI to be a fascinating topic. I've recently had this discussion with a friend whether AI has moral agency and if it's a sentient being or it might be a sentient being. So it's a very interesting topic that I personally am very interested in.
Yeah, an agency is just someone that sets goals and achieve it. You don't really need sentience. So if you're asking whether you need sentience to be an agent, I think that might be the wrong question to ask for with regards to AI ethics. For all I know, you may not even have sentience. You may not know that I have sentience. I may just be a robot here and a zombie. A classical philosophical kind of thing. How do we know that each other person's consciousness?
That's true.
And are we looking at the same thing? When we're experiencing certain things. So I think that's the wrong question to ask. The right question: what kind of agency they have, in terms of what kind of goals they set. Are these goals commensurate with our goals? Would they deceive us, in order to ensure their own survival? These are all the questions that all the creators of AI actually have asked. So I think you have to ask the kind of questions.
Right. I think that gave you plenty of work to do in the future. Thank you for talking with us.
Thanks, Serena.
Yeah.